Today on Talk Jeju, we're talking about MERS. As always, Todd Thacker joins me in the studio. So Todd, this is a very recent, very big story with a lot of repercussions for the nation and Jeju. At the outset, I'd like to reiterate that the island is still, at the time of taping, infection-free. But we're seeing the knock-on effects, I guess, already from stepped-up preventative measures to drastic changes in the public's activities just in the last couple of weeks.
Yeah, we are indeed, Nick. And it's chilling to think that all of this really started with a single traveler coming back from the Middle East back in May, this according to the CDC. So now currently we have just over 125 confirmed cases and around 3,800 people on the mainland who are in quarantine in special units in hospital wards, or they're staying at home. And they're being monitored currently for what is basically a 14-day incubation period. Jeju's had a number of people alert their doctors after showing sort of MERS-like symptoms, but all, as we saw in the news too, have tested negative.
Now, I think we should lead off with just what MERS is, and MERS, the acronym stands for Middle East Respiratory Syndrome. Just what it is and how it spreads.
Great. So, according to the World Health Organization, MERS is a viral respiratory illness that is basically new to humans and was first reported in Saudi Arabia in 2012. Now, the symptoms include fever, cough, shortness of breath, and it can be fatal.
Well, what about transmission? I believe it's not well understood how it spreads, though I guess they know it's not airborne, fortunately.
That's true. And in Korea, it's mainly been through direct contact with an infected individual. There's also a secondary transmission, and that's, of course, contact with contaminated surfaces. That appears to be the case as well, especially in hospitals. And what happened was when these patients started to come in with flu-like symptoms, the hospitals at that point didn't know what they were dealing with. So, at that point in late May, early June, we sort of didn't have the disinfection measures in place, and that's how these secondary infections happened.
So what is the provincial government doing right now to keep the island MERS free?
Well, in the long run, it could prove difficult to keep it contained, but the province has been putting forward things like funding to the tune of 1.5 billion won for measures, including stepped-up monitoring at our sea and airports, and of course securing quicker MERS tests and establishing an dedicated interim care unit at local hospitals.
So first then, the airport and the seaports you just mentioned. We reported a couple of days ago that more infrared cameras and protective gear like biohazard suits and masks are being made available to officials at these ports of entry, which see tens of thousands of arrivals daily. And the, of course, the infrared suits are to check for fevers.
Right, and that's certainly one advantage we do have here on the island. We have the ability to really closely monitor the comings and goings of our visitors. And so, of course, the mainland is much more vulnerable to this kind of primary and secondary transmission of MERS.
Yes, that's right.
So now we're stepping it up. We have emergency response teams along with that operate, on the government side. And there are full-time doctors and nurses on site, certainly at the airport currently. Now, those infrared cameras you mentioned, there are 4, and they're monitoring people as they come in. Mm-hmm. Anyone with a fever of 37 or over will be moved straight into a quarantine station, and they'll be able to see a doctor immediately.
And I should add that monitoring is being conducted on both domestic and international arrivals.
That's right.
Now, you mentioned measures for quicker tests results earlier, and then dedicated medical unit.
That's right, sure. So what we have is the Jeju Public Health and Environmental Research Institute. They now, as of a few days ago, have their own diagnostic reagent, which means that the final determinations on suspected cases can be made right here. They used to send the tests to the Korea Centers for Disease Control and Prevention on the mainland. That took days. Now it's just a matter of 5 hours or so to make a determination.
So that's a good step. And as I mentioned in the news earlier, Jeju National University and Sogipo Medical Center have set up isolation wards.
Right, but again, as of this taping, there have been no confirmed cases at them.
Now, despite that and the precautions in place, we've seen tourist arrivals dropping. Many people out wearing surgical masks in public, and many large-scale events being postponed or even canceled.
Yes, and more every day.
Now, one report that caught my eye recently quoted an infectious disease expert at a major hospital in Seoul, saying that, all things considered, the national reaction to MERS is a bit out of proportion, in his words. Again, it's not airborne for one, so just being in public will not necessarily result in an infection.
Right, this is very true. And, on the mainland, they're stepping up disinfection measures on public transit. Now, that makes a lot of sense. But then they go to there are some extremes, like the relatively low traffic areas, such as schools. Some principals have opted to close their schools temporarily. This seems a bit extreme. Even the CDC is advising the public to simply just wash their hands more often and to take care to avoid other sick individuals. And the CDC is also telling doctors that if they do see people with MERS-like symptoms to take a step back and first consider other respiratory illnesses such as influenza.
That's right. Because all of these symptoms are quite similar.
Yes.
Okay, moving on now. I'd like to hear more about the local effects of the mainland outbreak.
Well, some government offices here have reportedly stopped seminars and workshops for the time being. And we saw that Governor Won Hee-ryong recently canceled all of his scheduled trips to the mainland, and that even included a symposium at the National Assembly. He stayed here in order to handle the situation, so he's on top of it. And then just a few days ago, we've seen quite a few annual school trips being canceled or postponed, also concerts and festivals. They're all just putting up signs on their websites and things.
And we're just heading into kind of the high tourism season, this summer. So this can't be good news at all.
That's true. Now, the Jeju Provincial Tourism Association reported that over 10,000 people had canceled or delayed their trips to Jeju just last week, 1 week ago. And half of those were international travelers, many from China. So even though we're MERS-free at the moment, the effects and stakes could never be higher.
What about nationally?
Yeah, well, last Friday, the Korea Tourism Organization reported that the number of trip cancellations by people from China and other Asian nations came to 20,600, which was an eye-opening 74.6% increase from 1 day earlier.
Huge numbers.
Yeah, nearly 85% of those trip cancellations were made from people from China, Hong Kong, and Taiwan, according to the KTO.
So what's the outlook going forward then?
Well, the Korean CDC estimates that the spread of MERS will peak this weekend and then subside from then on. So that's one good piece of information. But financially, though, it's not good news. For one, the Seoul government estimates that if the status quo continues for, let's say, another couple of months, so 3 months total, the national economy could take a 20 trillion won. That's about a $20 billion hit.
And it's certainly an ongoing situation, and I guess, we all have to be vigilant, maybe not overdo it, but vigilant. Like you said earlier, frequently washing your hands is a good start. And of course, keep up to date on the news in the coming weeks. Okay, Todd, thank you for the report.
My pleasure.
If you have any questions or comments, please email them to talkjeju@kctvjeju.com. Thank you for tuning in today, and I hope you'll join us next week at the same time. If you can't wait until then, though, visit us online at eng.kctvjeju.com and follow us on Facebook. 시청해주신 여러분 고맙습니다.